Welcome, nurses. Welcome to our review. Let us answer 20 questions. So, let's start. Question number 1. You are a nursing assistant. When giving an enema to a patient, you ask the persons to lie on A. On their back, B. Their left side, C. Their abdomen, and letter D. Their right side. What is the answer? Letter B. Their left side. Question number 2. Is a production of abnormally large amount of urine by the kidneys more than 2,000 ml in 24 hours termed as A. Oliguria, B. Polyuria, C. Anuria, letter D. Dysuria. What is the answer? Letter B. Polyuria. Number 3. Blood transfusion is the introduction of blood directly into the circulatory system. Which blood type is a universal donor? A. Type A, B. Type AB, C. Type B, and letter D. Type O. What is the answer? Letter D. Type O. Number 4. Principles of drug action is a process by which a drug moves through the body and out for elimination. A. Pharmacokinetics, B. Pharmacodynamics, C. Adverse effect, letter D. Side effect. What is the answer? Letter A. Pharmacokinetics. Question number 5. In the principles of giving medication, which rights is not included? A. Right time, B. Right dose, C. Right error, and D. Right to refuse. What is the correct answer? Letter C. Right error. Question number 6. In Elizabeth Kubler-Ross grief theory, which is not included? A. Denial, B. Anger, C. Bargaining, C. Depression, E. Allowing, F. Acceptance. What is the answer? Letter E. Allowing. Number 7. Foundation of nursing. Which of the following is recorded as the systolic blood pressure? A. The point when the pulse is no longer felt. B. The point where the last sound is heard. C. The point where the first sound is heard. And letter D. The point 20 millimercury above where the pulse was felt. What is the answer? Letter C. The point where the first sound is heard. Number 8. The surgical creation of an artificial opening of the large intestine is called A. Gastrostomy, B. Colostomy. C. Tracheostomy. And letter D. Colectomy. What is the answer? Letter B. Colostomy. Question number 9. A healthcare agency or program for patients who are dying is A. Managed care. B. Hospice. C. Case management. And letter D. A preferred provider organization. What is the answer? Letter B. Hospice. Question number 10. Patients may become aggressive and assault nursing assistant. If this occurs, you ought to A. Immediately leave the patients and call for security. B. Talk patient in a calm voice and stay back. C. Telephone the family. And letter D. Ask the nurse to call the doctor to get an order for restraint. What is the correct answer? Letter B. Talk patient in a calm voice and stay back. Question number 11. A patient suffers injuries from a fall because a nurse's assistant forgot to raise the side rails of a bed. This is known as A. Malpractice. B. Negligence. C. Incidental. And letter D. Accidental. What is the correct answer? Letter B. Negligence. Number 12. In illegal and ethical behaviors, keeping information confidential about a client is A. Dependent on the situation. B. A legal responsibility. C. Applicable only to a medical records. And letter D. Somewhat important. What is the correct answer? Letter B. This is a legal responsibility. Number 13. Infection control practices. When cleaning a wound of a client, you clean A. Outward from the wound. B. Toward the wound. C. In circular motions away from the wound. And letter D. In circular motions towards the wound. What is the correct answer? Letter C. In circular motions away from the wound. Number 14. In infection control practices, instruments that penetrate a patient's skin should be A. Sanitized. B. Disinfected. C. Sterilized. And letter D. Treated with antiseptics. What is the correct answer? Letter C. Sterilized. Number 15. If the nursing assistant is concerned about client care, who should the nursing aide speak to first? A. Another nursing assistant. B. The patient's relatives. C. The nurse in charge. And letter D. The director of nursing. What is the correct answer? Letter C. The nurse in charge. Question number 16. The site at which to detect the popliteal pulse. A. Knee. B. Ankle. C. Forearm. And letter D. Foot. What is the correct answer? It's letter A. Knee. Number 17. A single order that is administered immediately and usually written for emergencies. A. Stop order. B. Standing order. C. Routine order. And letter D. PRN order. What is the answer? Letter A. Stop order. Number 18. In restraint, nursing assistant must know how to use it. The proper use of waist restraint requires that the nursing aid A. Tie restraint to the side rails. B. Monitor for skin irritation. C. Apply the restraint tightly to prevent movement. And letter D. Release the restraint every 5 hours. What is the correct answer? Letter B. Monitor for skin irritation. Number 19. Generally, the last sense to leave a dying person is the sense of A. Sight. B. Taste. C. Hearing. And letter D. Touch. What is the correct answer? Letter C. Hearing. Number 20. When encountering a fire, a nursing assistant should first A. Leave the area alone. B. Take all personal belongings. C. Remove resident from danger. And letter D. Close the patient's door. What is the correct answer? Letter C. Remove resident from danger. Thank you so much for your watching. Please do not forget to subscribe.